Good morning, everyone. We want to apologise that we have seemed to have disrupted the coffee break. And we know that that's going to be difficult. We have got a couple of videos in our presentation, so we're hoping that will ease you through that bit of time. It was a delight for us. We've just arrived from doing our breakfast group provision at our community centre to hear the end of Jen's presentation there. And we would say yes and amen to everything that she said. So we're from Lifecentre Salford. I hope, will it come up behind us? I can see it in front of me. And so we're a small community centre, Christian community centre in Salford. We've been working there since the year 2000. I've not been there that long, but Natalie actually has. And the majority of our staff and volunteers live within a mile of our building. It's a very hyper-local focus. It's a deprived area, but our vision is to work alongside local people for community transformation. And we hope that today we're going to give you a few ideas from some of the projects that we run about different ways to address health inequalities than perhaps you're used to hearing about. And if you are used to hearing about them, then hopefully you'll hear more. So we're going to give you an overview of 4 of our projects.
Hey, start again. Why do you run?
Because it makes me feel good. And I don't know, it's the happy hormone, isn't it?
And it's good to socialise.
Yeah, and the social side of it. Yeah.
What do you feel after you've run?
Liberated, excited.
Really good. Full of life.
Why have you taken up exercise, Janet?
Because I've got to middle age and I feel that I need to get fitter now, and there's no reason at this age why I can't.
I feel good because I feel that going consistently makes me feel better every day, every time I go. Yeah.
I run because it's helped with my confidence as well as feeling healthier, and I like running with a group of people. I find it really encouraging and fun.
I like running because it's fun and it makes me happy.
I think it's like a mental kind of, what's the word? It just makes you feel better to run. It like gets rid of all your energy and just, yeah, I feel better doing it, basically.
Women do surveys for us to share what their experiences have been, and we've seen reductions in their blood pressure, in asthma symptoms, obviously in weight loss, but also in confidence in their bodies as well, and around their mental health as well, so improved connection within the community. So many of them feel like when they're running, which I can't do when I'm running at all, they can talk to the other women and share their concerns. I don't know about you, Natalie, but I can't do that. So there's been lots of friendships built in our community and social connections between people that wouldn't necessarily have been friends otherwise. So for us, it's been a really fantastic project that's relatively low in terms of preparation and stuff like that, and yet they've been going for 8 years now, meeting every week to run. There's normally about 8 women that run each week, and there's 169 members on their Facebook group as well.
Fantastic. Next slide, please. So we were introduced as a group that feeds tummies, which is part of what we do. We've been involved in running holiday clubs for the past 8 years. And so just to give you an idea of what that looks like, we want to create a safe, welcoming, fun environment for children who are on free school meals. Now, a lot of you will know that children access free school meals during term time, but it can be a struggle during the holidays for a lot of families to then find the resources to feed their children well. So the holiday clubs have been set up to address that issue that we have witnessed firsthand from the connections that we've got with many of the families that we work with through the Lifecentre. We also heard from schools as well that this was a need that they observed. Our holiday clubs are much more, though, than just feeding tummies. We want them to be a place where children can experience a variety of activities. We have an hour's daily physical activity, and we have incredible enrichment providers who come in and do all sorts from comedy workshops to spoken word workshops. There's so much variety and fun for the children who attend. Now, when we started, it was based in our community centre just 15 children, and lots of volunteers from the local community would come along and help these clubs take place. And what enabled us to do that was small pots of funding. So we were able to get the volunteers to support what we were doing. But now, what we found is over the years we've been able to gather from our experience evidence as to why this works. So we were able to present that to the government APPG, and of course over the recent years the government has responded to campaigning that we have been involved in alongside other small community groups to raise awareness of this issue, and there has been changes in government policy. So the impact that we have seen has also been researched by the DFE, and what they have seen is that there has been improved nutrition, a reduction in food insecurity, there's been less social isolation and more community bonds for children, higher levels of activity and more stimulating and enrichment. So our holiday clubs have been so much more than just feeding tummies.
Brilliant. Are we okay with the next video? So Breakfast Group developed out of a number of conversations with the local primary school around children in our area for whom arriving at school was quite a stressful time. So we decided to see if we could get some funding and start to deliver a breakfast group that was a bit different from other breakfast groups here. When they arrive, we provide them with a really nice breakfast in the morning so they can choose cereals, toast, bagels, fruit. We want the children to feel very happy when they come in and mostly to feel calm and at home. So the feel of it is more like a family breakfast. So when they've had a breakfast, we spend some time looking at the children's feelings. So we'll use different types of materials to help the children to talk about their feelings. And then each day we'll have a focus. So we might be looking at anger management for a couple of weeks, or how to make friends with other people. And we'll do activities that help the children to focus and to build their skills in those things. Throughout it, the team will be using kind of strengths-based models, so trying to be as positive with the children as they can be. Often we have children coming here who are tearful in the morning, who are upset or angry, and so by being able to provide a bit of a cushion for that, that reduces the impact on the teachers and the teaching assistants in school. And for some of our children, they struggle to have their needs met at home emotionally, and so we provide a space where they can receive love and care and consistent contact with adults that can be positive towards them.
Me and Alfie have been coming here for 3 years, and I was a bit chaotic, if you can describe that. Shy, I want to speak. The only 2 words I say was please and thank you. I won't get to say nothing else. The boys, it's helped with their development. You can see the actual change in them from the last couple of years to where they are now. There's a big improvement in their behaviour, their attitude. It's been a really good experience for them. We even attend outside activities with Breakfast Club. That's how warm and friendly and welcoming it is. It's absolutely brilliant. Breakfast Club is fun, amazing and joyful. Breakfast Group for me is a happy place, a calm place, a relaxed place.
If you'd like to know more about Breakfast Group or our work at the Lifecentre and how to support us, please do get in touch. So our breakfast group is an opportunity for us to hang out with a small group of children each morning, and it's one of the best things that happens in my week is spending time with those children. And we've seen the impact of that over the last 8 years in terms of improving the children's nutrition, improving, the teachers tell us that it improves their attention span at school, that by giving them experiences of being around other adults, that it changes their aspirations around what they might want to do in the future, and that they have more confidence within their emotions and their ability to kind of go out into the world. We, again, had very small pot of funding to start that project, £2,500, and now it's supported by Kellogg's and by the local school and by fundraising. So it's not something that's taken a large amount of money to do, and yet it's impacted on the lives of those children, but also on the wider community as well, because as you could hear Stuart say, we don't just involve the children, but we also support families as well, and we go out to the beach or Blackpool or wherever it might be together. We go together, not us taking a trip, but we all go together. And we have lots of fun together. And in that, we build those social connections. And it meant that when COVID happened, it was easy for us to continue to support those families to pop round and do stuff on the doorstep, which was great. If we can have the flag football slide, if possible.
So we have this fantastic work that we're privileged to engage in with children. We've found out about the Breakfast Club and about the holiday clubs, which are now expanding across the whole of Salford, and we've got about 900 children that can access that. But we also involved with flag football. Now, who here has heard of flag football? Not even one person. That is fine, because I hadn't heard of it either until I went and saw the Salford Scorpions, who are pictured on the screen at the moment. Now, the idea of this was set up by a local person who was incredibly passionate about sport and making connections with people. Now, what it looks like is it's free training that's available every week to adults, and it's led by volunteers. And again, it's another project that has been enabled to happen because of small pots of funding. Now, this has been funded by Salix Homes and NHS CCG. And what that goes towards is these weekly training sessions, a venue, insurance, and this fantastic Salford pink kit. Now, it's enabled 30 adults to connect, and we can kind of track the physical fitness profile of these guys, because the first picture at the top is when they initially got together. The white kit is when in their early days, and then the Salford pink kit is more recent. They're now competing in a national competition, but it still remains a free, accessible thing for all adults. And there's normally about 18 guys who connect in with that every week. We've also been able to extend these sessions to young people, and we found that it's particularly well attended by young girls. These sessions demonstrate the positive outcome and the impact that volunteer-led sessions can have. And at these sessions that are for young people, we've had about 80 people that are part of it, but on a weekly basis we get about 20 attending. I'd love to read you some quotes. They're on the next slide. We've had so much feedback, but we've just selected a few of them so you don't get too bored. So, flag football is the highlight of my week. Without it, I wouldn't have been able to find a new sport that I would come to love, which has brought out the best version of myself. This has crossed over into my work and family life, which has changed dramatically because of this weekly activity. I thank flag football for helping me to be the best person I could be and bring a smile back to my face. Flag football gave me the push I needed to improve my health. After several health setbacks, football gave me the opportunity to get myself back on track. From football, I've been able to take part in weekly park runs and continue improving my fitness and health. Without flag football, I'd have no social life. Because of flag football, I am more socially active than I have ever been. From flag football, I've been able to take part in charity runs, social outings, and meet people with similar interests in mine. Thanks to flag football, I have a more positive outlook on life. I was quite lazy before the project got me out of the house, making new friends, and also losing weight.
So hopefully that's given you just a little overview of 4 of the projects. We could talk about the projects all day, couldn't we? So we won't, because of the coffee break, which is coming up. So we've got just a few takeaways that we thought you might want to think about going away from today.
Okay, so the first one, local people have great ideas how to reduce health inequalities. I think sometimes we can think we've got all the answers, but in fact, there are people in our communities who have fantastic ideas, as we've demonstrated through some of our projects, that we can get alongside them and draw on those passions, those interests and those skills and those knowledge.
Yep, hopefully you can see that all the projects that we've talked about started off with really small amounts of money, and you might be part of a GP practice or a CCG that has pots of money to help with health inequalities. If you have, why not consider supporting one of your local community groups, or seeing if there's a local CVS to you that might distribute some funding to support health inequalities in your area. You might find that it even changes government policy as a result, because small community groups can multiply that money big time and campaign with the difference that it makes. And for us, we've seen that go from no funding in Salford to £1.3 million a year for half. So,
have a think, what community groups operate around you? Because that's a good starting point, isn't it? And also, how can you see the person in context of where they are in your community? And what are the connections that they have or maybe don't have? Because our input can help to expand that, but being aware of the person in context is very important, as was mentioned in the previous talk.
Yep, I'm afraid this one's been cut off a bit, but this is just a little bit about our approach at the Lifecentre, to say that we try to approach people by looking at them as functional as opposed to dysfunctional. So we base that on some work from Richard Schwartz and the internal family systems that thinks about the fact that people who've experienced trauma, and all of us have had some level of that, but often in deprived communities we know that people have experienced more. The choices that we make and the behaviours that we do, whether it's using alcohol or substance misuse, ending up obese because of overeating or not exercising or whatever it might be, often those things are functional for us because they protect us from that trauma or that pain. And so rather than seeing that as something that we just need to deal with, that issue of substance misuse, we at the Lifecentre want to ask about why that is, what it does for that person in their life. And so I'm sure that's similar to what Jen was talking about in terms of being trauma informed. But that's really important to us, that we recognise that people's bodies and minds are often trying to look after them and protect them. And so we want to treat people with kindness in that way and work out what's happened that's led them to this behaviour, which might not be good for them in the long term, seeming functional in the moment.
And finally, everything is better done together. So it's not about doing things to or for, but with. Let's draw on the skills and the local knowledge and the passions of the people in our communities.
Thank you very much.